Well, if you or a loved one goes to the hospital, you expect a certain level of care, but that's different in the last year and a half. One reason, they're short on staff. Remember that $1.8 billion Mississippi is getting in federal money as part of the American Rescue Plan? Well, the Speaker and Lieutenant Governor are asking Governor Tate Reeves to give them the go-ahead to direct some of that to the hospitals. Courtney Ann Jackson explains.
We have, over the past year, and probably even to a greater extent over the past 6 months, lost a number of nurses to travel agencies and leaving their hometown hospital, their community hospital.
Singing River Hospital's chief nursing officer says it's forced them to bring in contract agency nurses.
Now, if you took the contract and agency nurses out, half of our floors would have to close.
For those who have stuck around in Mississippi, it's costing more to keep them. Neshoba General's payroll since the start of the pandemic has gone up $100,000 per pay period, $2.6 million more a year.
Our margins are razor thin as is, and we all have received some CARES Act money that helps us offset some of these costs, but it doesn't cover it all. There's not enough funds there that we've received that helps us balance that equation. We've all had to get creative and come up with special compensation arrangements to attract our staff to work more shifts or bring in some additional staff to cover those vacated shifts.
But understand this, it isn't just a business issue for hospitals.
There's a lot of reasons that we all should care, whether we're in healthcare or not, because the need to have qualified staff in our hospitals when any of us have a medical emergency, whether that's an automobile accident or a farming accident or whether it's a heart attack or stroke. You need qualified staff there to take care of those patients. And in order to do that, we have to find a way to pay them.
The 5-month contract possibility that legislative leaders have suggested is being viewed more as a short-term solution by some hospitals.
That's great. That's better than what we have right now. But, I beg to ask what's going to happen in a year, 2 years from now, especially as less people are going into and graduating from nursing careers.
Courtney Ann Jackson, WCBI News.
The governor has not yet made a decision on whether he'll call a special session at all.